Hello, everyone. Can I get a thumbs up if you guys can hear me? Awesome. This is so exciting. Look how many people are here. This is great. My name is Dr. JJ Rawlinson. I'm the Senior Manager of Community Partnerships and Welfare Initiatives at Annenberg PetSpace. We are very excited to bring you the third session of our new PetSpace Wellness Workshops. These sessions are designed to directly help you strengthen the human-animal bond between you and your pets through the guidance of animal experts who will explore practical, everyday issues for pet parents. We are excited to welcome the amazing Dr. Karen Sueda, who will be discussing the relationships with our pets both during and after the current situation we're all in, the Safer at Home orders. We'll begin with her presentation, and afterwards we'll have time for a Q&A, so please hold your questions until the end. And then before we begin, I'd love to remind you that we are now offering adoptions by appointment only at this time. And we've also expanded our online daily program offerings. So take a look at our website at annenbergpetspace.org for all of the details. For those with dogs at home looking to work on their obedience skills, we are also offering a new series of our Mutt Manners dog training classes in September. So also, again, visit our website for more details on that. We're also partnering with Hometown News to offer a fun new pet photo contest for pet parents. So visit the hometownNewsOnline.com to see how you can submit a photo of your dog or cat for a chance to win a prize package. Now, without further ado, we are pleased to welcome Dr. Karen Sueda, who currently works at VCA West Los Angeles Animal Hospital as their board-certified veterinary behaviorist. After completing her residency at the UC Davis School of Veterinary Medicine, Dr. Karen Sueda joined VCA West LA as their board-certified vet behaviorist. Dr. Sueda's special interests include feline behavior, canine anxiety disorders, and our favorite, the human-animal bond. She credits her cat Tyler for teaching her more about feline behavior and training than any textbook. We love those cats. So please join me in welcoming Dr. Karen Sueda.
Thank you so much, Dr. Rawlinson, and thank you to the Wallace Annenberg PetSpace for having me today, and thank all of you for taking time out of your busy schedules with work and home life and everything all under one roof. I appreciate all of you spending some time with me. So I will go ahead and start sharing my screen, and we'll go ahead and start the lecture. Wonderful. So canine separation anxiety is a topic that a lot of people just in general find very interesting, and it's always a topic I get asked about a lot. And I think it's especially relevant nowadays because I think all of us are experiencing some separation anxiety ourselves, whether it's some separation anxiety from our friends and family that we can't visit. And I think we all can identify with dogs that have separation anxiety, especially now, because we just don't know when the real world is going to come back. You know, we're all just like those dogs with separation anxiety, stuck at home, wondering when life is going to return and just not knowing when that's going to happen. So I think we can all, you know, empathize with our canine companions right now. So I think this is probably a lot of us nowadays. We just don't know what's going on with the world and how unexpected life has become. And one of the big things that I get asked about a lot are, hey, our dogs are with us 24/7 now, and how is this affecting their behavior and especially with their bond with us? And that's one of the questions that we'll be exploring today. Of course, as we head back into work or school, or just as things reopen and we start experiencing life again, how is that going to affect our dogs? You know, as we start spending time away from home, is the fact that we've been here with them all of the time now going to cause them to have separation anxiety once we start spending more time away? So that's the question a lot of clients are asking me right now, is this what they're going to return home to once they're back at work? And then of course, we just don't know, are we going to have to go back to the stay-at-home orders again? And is this just going to be a cycle that keeps repeating themselves? So the questions that we'll kind of explore together today, because no one really has any or all of the answers right now, is we'll go over briefly what is separation anxiety. And what you might find is that that's not necessarily a straightforward question. I also want to talk a little bit about how the pandemic has affected dogs' behavior. There's some studies out now that I'd like to share with you that might help us answer some of those questions. And then how do we even tell if our dogs have separation anxiety? Because the best way to prepare for future behavior is to understand it and know and prepare for it. And of course, if we do have dogs that have separation anxiety, how do we treat it? How can we make our canine companions feel better when we're gone? So just starting off, what is separation anxiety? Well, the straightforward answer is it's anxiety when a dog is left home alone. And that word anxiety both encompasses both the fear and the dog experiences when when they're home by themselves, but also that worry about being left alone. So that kind of dread feeling as well. And literally, just like this dog in the video, our dogs are having panic attacks when they're gone or when we're gone. And all of the behaviors that they display, whether it's destructive behavior or barking or even house soiling, are all because of two things. One is they're trying to reunite with us because of the separation. And the second one is that all of these behaviors, like the dog chewing up the rug, is coming from that point of fear or anxiety as well. These are dogs that are not eating, drinking, playing, or just enjoying life when we're not there. And it's a very pervasive problem. So even before the pandemic hit, there's one in 7 dogs in the United States actually has separation anxiety to some degree, some more mild, but definitely some more severe. So there's been a ton of studies. Again, even before the pandemic hit, this is a really difficult problem for a lot of people to solve. And so there's been a lot of scientific studies looking at separation anxiety. I just wanted to highlight a few of the things that have been found to be associated with separation anxiety, because I think they're very pertinent to the pandemic situation that we're finding ourselves in. One is that a lot of dogs with separation anxiety actually have other forms of anxiety as well. So it seems that the more anxious the dog is, the more likely they are to have separation anxiety or develop it. Another thing that we found, again, are dogs that have never really been left home alone or just never learned really to be comfortable being left home alone, are more predisposed to showing separation anxiety. And when owners were surveyed, about 16% of owners that were surveyed actually could correlate a specific change in their schedule or the dog's household or situation, and could correlate that change with the onset of separation anxiety. So one thing I often experienced, especially when I worked at UC Davis and I was doing my residency there, was a lot of people who would adopt dogs, a lot of students who would adopt dogs during those summer months when they had time off. The dog would get used to the student being there for several months, day in or day out. And then when that student started going to school again, or was mom and dad left home to go to work after maybe being laid off or not having a job for a while, that's when the dog had started experiencing separation anxiety. And again, about 16% of people could correlate the dog's start of separation anxiety with that change. So even before all of us were set stay-at-home orders with the pandemic, some of these dogs were already starting to show signs if they had been left home or been with somebody for a while, and then that schedule change happened and they were left home alone by themselves kind of for the first time. So again, I mentioned that there have actually been a few studies out there now showing how the pandemic has affected dogs' behavior. And one of those studies that's just recently published was conducted in Spain. So Spain actually closed down. I think they had a nationwide shutdown starting in March 14th. And as a comparison, Los Angeles County went into shutdown mode around March 19th. And so right at the beginning of Spain's shutdown mode, they thought, hey, let's start asking people how this is affecting their bond with their pets and the pet's behavior. So my colleagues that actually work in Spain sent out a survey to Spanish pet owners asking questions about their relationship with their pet and how their pet's behavior has been changing during that shutdown period. Um, Amazingly enough, because I'm sure they all had time on their hands as well as we do now, almost 1,300 people responded to that survey and submitted questions or submitted answers to the questions that were posed. 61% of those surveyed were dog owners and 39% were cat owners. And at the time they answered the survey, it was still early in that shutdown period for Spain, but on average about 61% of the respondents had been confined to their home for 3 weeks at least, and another 21% had been confined to their homes for 4 weeks. So they had a pretty extensive lockdown order. And so again, like early on in Los Angeles, only those people who had, were emergency or, who had jobs that were considered to be essential workers were allowed to even leave their homes. So most people were indoors most of the time. What they found was that the lockdown itself was great for pet owners because it actually found that the emotional bond with their pets became stronger and that they interacted with their pets more. And so this was actually really useful for a lot of pet owners to have their pets with them. So 47% of people that were surveyed said that their pet helped them much more, moderately more to much more compared to pre-confinement time. So their bond and their emotional attachment to their pet actually got much stronger during that month-long confinement. However, on the other hand, that whole lockdown period was not as good for dogs. So it was much tougher for the dogs to be stuck at home with their pet parents than it was the other way around. What they ended up finding was one of the questions that they asked was how their pet was just generally behaving. So on a good note, about 30% of pet owners said that they didn't really notice any difference, that their pets were behaving very similarly to pre-lockdown mode. But the ones that I wanted to point out was that about 42% of pet owners said that their dog was actually more attention seeking during that time. So it's almost as if those dogs had realized that they kind of had a captive audience with all the family members there and started getting and soliciting more attention from them. The other concerning fact, though, is that about 25%, or even one in four dogs, the owners thought that they were more nervous. So just being home with their parents 24/7, they were starting to see more signs of anxiety. And maybe those dogs were picking up on the anxiousness of their owners as well. And then about 16% seemed just more stressed, and another 18% just seemed frustrated. So a lot of these changes that the owners were seeing in terms of their dogs' behaviors, just generally speaking, weren't necessarily great for the dogs. Another question that was asked was how, if your dog had some behavior issues before, how did the being in lockdown affect those behavior problems? So they actually asked clients or those pet owners, was your dog aggressive? Was your dog excessively vocalizing? And the one I circled, of course, is, did your dog have any problems being left home alone? So of those dogs that were surveyed, the nice thing is that about 55% never had that problem and never developed it during the lockdown period. So those 55% of dogs weren't showing any issues being left home alone. What I did want to point out is when there were changes to that behavior issue. So about 28% of owners said, yeah, my dog had issues being left home alone, but again, I don't notice any difference now. So it was kind of the same as before. The nice thing is that maybe about 5% of dogs actually improved in their separation anxiety while their owners were home for this lockdown period. And of course, that makes sense. If their owners were leaving a lot less often for a lot shorter period of time, it would be natural to think that, yes, their separation anxiety during that lockdown was improving. The concerning part, and I think the question that we have right now, in according to this lecture, is about 12% of owners reported that their dog, the separation anxiety actually got worse. So what we don't know though is what that 12% of dogs represent. So if you think about 12%, that's 1 in 9 dogs where their separation anxiety got worse. One possibility are these dogs had separation anxiety before the lockdown in Spain happened, and that anxiety got worse even during it. And why would that be? You know, again, if your parents are home alone or home with you all the time, and you're not home alone, why would the separation anxiety get worse? You know, could it be that yes, those dogs actually did get when they would have to leave, it was for shorter periods of time. They had to go get groceries. They had to, you know, go to the doctor's office. You know, was that just a more salient departure than it was before because the dog had gotten used to their mom or dad being home with them? And then the other thing that we don't know is that were some dogs, had they never shown anxiety before the pandemic happened, but now that they got used to the fact that their owners were home alone, now they suddenly developed separation anxiety during the pandemic lockdown phase. So that we don't know from this particular survey. What I did want to go back to are those other two, you know, facts that we brought up. So that 42% of dogs were more attention seeking and demanding. So again, are these dogs that are just getting used to people being around, getting attention all the time on demand whenever they want it? And now when we go out and leave the house and the dogs don't get attention on demand whenever they want it, is that going to set up the dog to have a frustration issue or more anxiety? And then knowing too that, you know, a proportion of dogs, 25% were more nervous and 16% of dogs were more stressed during this pandemic period, going back to some of those factors that were, you know, were predisposing dogs with separation anxiety. Knowing that dogs that have separation anxiety have other anxieties as well, making dogs more anxious, are we therefore, again, setting them up to have some separation anxiety if anxiety itself is a predisposing factor for that issue? So things to keep in mind when we're talking about the pandemic and how it might affect our pets. So of course, how do you tell? So that's the main point of you know, our talk today is we don't know and we can't necessarily predict if your particular dog has separation anxiety or will develop separation anxiety, but are there any cues now that we can tell that will help us predict whether your dog is going to be more likely to have separation anxiety down the road once you start spending more time away from home? So of course, there's the big, more severe clinical signs. So these are the signs that most owners will come to me for as a veterinary behaviorist. So once the behavior has gotten severe enough that it's causing a really you know, detriment to either the pet's quality of life or the pet parent's quality of life, that's typically when I see them. So about 72% of dogs will present for destructive behavior. Typically that destructive behavior is centered at exit or entrance points. So again, thinking that the goal of the dog's destructive behavior is to reunite themselves with their mom or dad, that's typically why it's centered in those areas. Sometimes we also see destruction of objects associated with owners, maybe things that have the owner's scent on it. So a pair of shoes that are left near the door, or the jacket that you wear around the house. Dogs will also present for distressed vocalization. So like the video that we were showing before, the dog was not barking because it had, you know, it saw somebody outside. You could tell by the quality of that dog's barking that it was distressed and anxious. And of course, house soiling. So these are not dogs that are, you know, I'm mad at you and I'm going to pee in the house. These are dogs that are so anxious that they lose, you know, bladder or bowel control. And that's what's setting them up to have, to urinate or defecate in the house. And these are the clinical signs that, of course, are going to leave evidence. So when you come home, you know that the dog had been chewing at the door, or you can see the urine that the dog has left. Or you have the angry note on the door from the neighbors or the landlord saying that your dog was barking the whole time you were gone. And I think it really is distressing, not only, of course, for the dog, but the worry the owner has, not knowing what they're going to come home to, or in some cases, even potentially facing eviction because, you know, their landlord is complaining that the dog is bothering the neighbors. The hard part, though, are the signs that don't necessarily leave their mark. So things that you may not even realize. So some dogs with separation anxiety may not be showing those obvious signs, but are still going through a lot of panic when you're gone. And we don't know that even if they're not destructive or not vocalizing, I can't necessarily say that mentally or emotionally these dogs are not experiencing less anxiety than those dogs that are chewing up your blinds. So some of these are just the refusal to eat or drink. So I've had owners where they say, I could literally leave a T-bone steak in the middle of the floor and my dog would not touch that until I came home. The dog that you see in the video here is just sitting there staring off and is drooling and profusely hypersalivating as well as panting. I've had a few owners think that their dog has spilled their water bowl because when they come home, their entire ruff, their entire chest is just drenched. And that's not necessarily from spilling their water bowl or lying, lying out in a puddle. It's because they've been hypersalivating that whole time. And of course, some dogs, and this is what happened with my mom's poodle when, in retrospect, growing up, is our poodle would just lie at the front door, head on his paws, and just wait for my mom to come home. It didn't matter if I was home, my grandmother was home. He would just sit there staring at the door, waiting for her to come home. So even though there isn't any, again, destructive behavior or something that's left clinical signs, these dogs are also experiencing anxiety. So how do we know? Video. Video and security cameras are a veterinary behaviorist's best friend because it allows us to spy on our dogs and see what's going on when we're not there. It's another set of eyes. And especially now with so many of us, of course, doing Zoom or having security cameras, it's really easy nowadays to actually find out what your dog is doing while you're gone. So back in the day, we used, landlines and things like that, or handheld video cameras. But you can even do things like, Zoom, like have a Zoom meeting with yourself. So set up a Zoom meeting where you're zooming into the video that is you're on your desktop at home. Or if you have a tablet or a phone that has video capability, you could leave that running with the video going of your living room, get a wide angle view of your living room or wherever your dog is going to be, and go and take a walk around the block. But there's also great security cameras that are very inexpensive. So there's the Nest system, of course, the one with the cute little poodle doodle dog looking at it is called a WiseCam, WYZE, really inexpensive home security camera that you can record video on as well. So these are great tools to you to know what your dog's doing when you're gone, but also as we're working on the behavior problem to know that things are getting better and things are improving. So what you're looking for on those videos, of course, besides those, barking dogs, pacing, panting, are just signs of anxiety. So fearful body language. Things, of course, that most dog owners are aware of are their dog's ears being pinned back or their tail being tucked or, just refusing to eat the nice, wonderful greenie or bone that you left behind. But other signs of distress can also include what we call displacement behaviors, things like lip licking or yawning, normal behaviors just out of context for what's going on. So if you see your dog pacing between the front door to your back door, every so often it'll stop in mid-stride and give a big yawn. It's not because your dog is bored to death because the most interesting person in the household is gone. it's more likely that the dog is actually anxious and that yawn is a sign of anxiety. So here's an owner. I'll pause the video for just a sec, right in mid-action. This is a video that a client took because she came to see me because she thought she was having a really difficult time house training her dog. So she thought that, you know, despite all of her efforts to house train her dog, he was still having accidents in the house. What we didn't realize until we videotaped this dog when she was home, when she was not at home, is why the urination was happening. So this is just a video camera that was set up. So the dog pees, then walks over to her front door, starts barking, and was doing that the entire time she was gone. And because her door was glass and metal, she never saw scratch marks, never really thought of it as a big deal. You know, yes, of course, there was nose prints on the door, but what dog doesn't go to the door right when the owner was gone? So we really didn't realize that this dog's house soiling issue was actually due to separation anxiety. So this can be a really, you know, great benefit of being able to videotape your dogs when you're gone if you have any questions about whether or not they have separation anxiety or not. You can also tell that a dog might be anxious even before you're gone. So there's certain behaviors that dogs will show even when people are around. So dogs that have separation anxiety are actually 5 times more likely to be anxious in that period of time as you're getting ready to go. So as you're picking up your keys, you're taking your, you know, you're putting your jacket on to go for your work, you're grabbing your work bag, or you know, you're getting your purse. So all of those things that indicate to the dog that, hey, mom or dad is about to leave, that's when you might start seeing the dog becoming extra clingy or following you around or starting to be wide-eyed or pant. When you come home, dogs with separation anxiety are 4 times more likely to have an overly exuberant greeting. And these are greetings that last for longer than a couple of minutes. So of course, totally normal for dogs to be happy that you're gone, that you're back after you've been gone, whether that departure has been 5 minutes or 5 hours. But most dogs will come greet you excitedly, maybe grab a toy and then settle down. These are dogs that have a really difficult time settling down because they were so panicked when you were gone to begin with. And then separation anxiety dogs are also what we call Velcro dogs. These are dogs that stick to you like Velcro as you wander around the house. So a common question I ask my clients is, can you go to the bathroom by yourself, or does your dog stand outside the door waiting for you? And 99% of the time they say, yeah, like I can't go to the bathroom, I can't take a shower by myself, because as soon as I try to go to the bathroom, my dog is out there like a creeper waiting for me. And so these are dogs that are 3 times more likely to follow owners from room to room. They could be dead asleep, and then if you stood up to go to get a glass of water from the kitchen, the dog's head would pop up and they would know that you're about to leave the room. What I do want to bring in mind, though, is that just because a dog shows bad behaviors or undesirable behaviors when you're gone does not necessarily mean that they have separation anxiety, because there's a lot of other reasons dogs can misbehave in the absence of the owner. So I've had many an opportunity to have videotape of dogs having the time of their lives when their owners are gone, because when the cat's away, the mouse will play. And so I've had clients come to me saying that their dog has separation anxiety or thinking their dog has separation anxiety. And when I ask them what their dogs are destroying, they say, hey, he'll grab pillows, the remote control, he'll grab the stuffed animals out of my daughter's room and rip them to shreds. And when we videotape those dogs, they're having a grand old time when people aren't there. You know, if I do these fun things, if I rip up stuff when my mom or dad's here, I get busted and I get yelled at. But hey, if they're not here, game's on. So some of these dogs may just be having, you know, a fun playtime with some of these objects. In other cases, something else externally might be causing the dog's anxiety. So the alarm going off, the low battery detector on smoke alarms, that high-pitched chirp drives dogs insane. And so I've had clients where an external noise like that will cause a dog to try to break through windows. And it's not separation anxiety, there's actually a noise aversion or a noise phobia component. Um, for barking, some dogs are barking when they just hear other dogs bark or when people or other dogs walk by the house. And if you live in a busy neighborhood, that might be going on for a lot of the period during the day. And so, the barking may not be separation anxiety related, but maybe a territorial or alarm barking component. And again, for dogs that are house training, we want to rule out medical problems, especially. So we want to rule out, does your dog have a urinary tract infection or a kidney disease or an endocrine disease where they just really can't hold their urine for that long because of a medical issue? There may just be poor opportunities. And this is something to bring up too in light of the pandemic, is that now that we're home with our dogs and we have the opportunity to walk them 4, 5, 6 times a day, some dogs may start realizing, hey, I don't have to hold it that long because, mom or dad or my big brother or big sister takes me out every 4 hours or so. But as we transition back into being away for longer periods of time, we may almost have to retrain our dogs to know how to hold it for longer periods of time as well. So that's another type of transition that we might be thinking about as we're, life is reopening up, so to speak. Things that separation anxiety is not. And I think this is really important to bring up, that it's not a bad dog behavior, and it's not because the dog is vengeful or spiteful. They're not mad that you have to leave them. And they're trying to get back at you and ripping up your favorite shoes because you're gone. These really are dogs that are having an anxiety attack when you're away. So if we punish them, if we do things to make them feel worse when we come home, it's just making their anxiety worse, and it's just confusing them more. They were saying, hey, I'm so worried and stressed that you're gone because I love you so much. But when you come back, you yell at me. So now I'm even more confused about this whole situation. So really to emphasize that, this is not a bad dog problem. This is an anxious or fearful dog problem. So what if your dog has separation anxiety? What can you do? And even if your dog doesn't have separation anxiety, what steps can we take now to prevent it, or at least lower the risk once we start, spending more time away from home? So going back to what doesn't cure separation anxiety, and I think, again, these are important points to think about because a lot of clients have these exact same question. So separation anxiety is an emotional problem. So just like with human anxiety disorders, exercise is great and it can help, but it's not the be it and end all. You could run a dog with separation anxiety for 10 miles and it'll come back and it's exhausted, but it's still emotionally going through panic. It's still, if the dog is panicking enough, it's still going to have some destructive behavior. It still may bark despite how tired that dog is. So exercise alone often is not enough. It may tire the dog out enough that it's not physically able to chew up the whole door, but anxious enough to chew up a third of a door. Another pet is usually not the cure either. So really the dog's bond is with the person that's leaving. And so in most cases, just getting another canine companion is not necessarily going to help. Now, there are times when having another companion might help, but it's not something where I would advocate go out and get another dog and your dog won't have separation anxiety because they have a playmate. What I usually tell clients, if they really want to explore this possibility, is, hey, does your dog have a dog friend, like a buddy that has been over, their dog really likes spending time with? Ask that dog's owner if they'd be willing to let you borrow the dog and then leave that dog with your dog and videotape it while you're gone. If your dog's anxiety is a lot better with a canine companion there, great. All the more reason maybe to find another dog buddy, or just borrow your friend's dog and trade off walks and things like that. But typically speaking, another pet is not going to be the cure. And then rehoming. These dogs again are experiencing separation anxiety because they bond very strongly. And if we try to rehome dogs with separation anxiety, they have a big heart. So they're likely to bond with another person and more than likely going to experience separation anxiety again in a new home. So the issue there is that rehoming may help only in the sense that it may help provide more management. So if this dog is rehomed with someone who maybe doesn't have to leave the dog, home alone as often, maybe that person works from home, it might decrease the frequency of the separation anxiety. But let's face it, all of us at some point need to leave the house, whether it's to get groceries, whether it's a doctor's appointment, whether it's to visit another friend, or even just, God forbid, get our hair done, things like that. There's times where you may not be able to take your dog with you. And so every dog's going to have to be left home alone sometimes. What we can do though, if our dog has separation anxiety, are these 6 steps. And these are steps that you can even take regardless of your dog, even not having separation anxiety now, but if you want to take steps to prepare or prevent your dog from developing it. So like we talked about earlier, the biggest thing is don't punish these dogs because, again, they're experiencing panic, and the more we contribute to that sense of inconsistency or anxiety, the worse the behavior problem is going to get. I also advocate talking to your vet about these problems. Your vet is a great resource for behavior issues. And if your dog has serious separation anxiety, the type that has destructive behavior or excessive vocalization, there's actually medications that can help. And we'll talk a little bit about that a little bit later. But your vet is the only one that can prescribe that. And the biggest thing is to rule out medical problems. So, does your dog have a medical issue that might cause it to be uncomfortable, especially while you're gone? So is there any pain or discomfort that's leading to, lowering the thresholds for anxiety? Or is it a situation where we need to rule out medical causes for house soiling? Big one is just to avoid panic attacks. And there's 2 ways to do that. One, of course, is don't leave your dog home alone if you can help it. And we'll talk a little bit about some ways to do that. And then medication also, or over-the-counter anti-anxiety products, which we'll also talk about, can help reduce anxiety. 2 things training-wise that we can do is reinforce independent behavior when you're actually home with your dog. So most of these dogs are so tightly bonded to you. Remember, these are Velcro dogs, that just increasing independence from you, even when you're at home, can help. And then gradually making departures a positive experience for your dog. So leaving things for fun for your dog to do when they're home alone can help prevent separation anxiety. And then again, monitor. Use those security cameras, use your Zoom calls to yourself to monitor what your dog's behavior is like, and then work at your dog's pace. So we're not going to leave your dog home alone for 6 hours right off the bat, but do little baby steps headed toward the right direction. So just to go through kind of a flow chart of how we're going to be approaching the problem right now. So first of all, does your dog have separation anxiety or not? Again, you'll know from clinical signs and video. And right now, during our stay-at-home orders, we may not be leaving our dogs very often, which is great. But when you run to the grocery store, when you go run some errands, when you take that walk around the block, that's a great time, even if you're gone for 10 or 15 minutes, to videotape your dog. What does your dog do during those 15 minutes that you're taking your exercise break and enjoying the outdoors right now? If your dog is totally sleeping, could care less that you're gone, wonderful. You're golden. We can start talking about prevention. But if on that video, you're starting to see signs of, as soon as the door clicks close, the dog's walking over the door and starting to whine and sniff at the door frame, we might want to start talking to your vet about having some separation anxiety developing. So prevention-wise, those dogs that could care less right now when we're videotaping them, we can talk about doing some training, how to leave your dogs with some fun objects to make your departures a positive experience, and how to gradually increase those departures. So go from a 15-minute walk to a 30-minute walk, maybe build in some time to run a few more errands as we're starting to work away from home. Maybe if you're getting called back to work in an office or outside of the home setting, maybe start with just being gone for a few hours or a half a day and build up to longer days if that's a feasible option. But if your dog is starting to develop signs of separation anxiety, again, talk to your vet for all those reasons. One, show those videos to your vet so your vet can help you confirm a diagnosis of separation anxiety. We also want to rule out physical illness, and then talk to your vet about working with them to develop a treatment plan to address the separation anxiety. I usually break down separation anxiety into mild or more severe symptoms. So mild symptoms might be those dogs, again, that aren't, showing severe distress. Like my mom's poodle, the dog that would just sit there with his head on his paws and stare at the door. Or the dog that cries and whines for a few minutes, but is able to calm back down after a little bit. Those are dogs that, again, could use with some training and behavior modification that we'll talk about, but maybe more amenable to over-the-counter anti-anxiety products. But of course, for those dogs that are barking, howling, being destructive, ripping down blinds, house soiling, those are much more severe cases that warrant much more, more developed behavior plans. So again, in addition to the training and behavior modification, these are dogs that I really do advocate for using anti-anxiety medications to help, cut and stop that practicing of that anxiety association with the departures. And these are also dogs with more severe signs that it would warrant working with a behavior trainer or a veterinary behaviorist as well. And then monitor, of course. So it's not one-stop shopping and one treatment plan fits everything. Is that it's a constant monitoring with those video cameras to make sure that your dog is getting better. So prevention at home, what can we do? So first of all, just leaving your dog in the location where they feel the most comfortable. And that really varies from dog to dog. For the dog in the video, this dog's owner leaves him in his bedroom. So he doesn't have free run of the house, or she doesn't have free run of the house. But the dog does do better when it's confined to a smaller area in the house. Some dogs much prefer to be able to roam from room to room, and that having more space helps them. I'm not a huge advocate for crating dogs that have separation anxiety unless the crate is a place where they're already used to being and they feel very comfortable in. For dogs, unless they're going to be injuring themselves, the dogs that literally are throwing themselves out of windows or, chewing their way through doors and breaking their teeth, I'm not a huge advocate of crate training simply because the crate is like a straitjacket where it's going to be just another barrier for them to try to get through. And in all honesty, that's where I tend to see the most physical injury to dogs is broken tooth or lacerations from dogs trying to escape from crates. You do want to leave the dog with a longer lasting food treat or higher value toy. So this dog has separation anxiety, but was interested in the little puzzle toy, at least for a minute or two when his owner or her owner left. So it can serve sometimes as a distraction, especially in cases where we're either trying to prevent separation anxiety from happening or the separation anxiety is relatively mild. And then like this owner did, he just left. He didn't make this departure a big deal. So the less you can tell your dog, I'm so sorry I have to leave you. Mom will be back so soon. I'm so sorry. And give your dog a lot of attention right before you're gone. And the same thing when you come back home, not to make it a big deal. Walk in, be calm, maybe take a few minutes to put your things down and wait till your dog is calmer before you greet him or her. That kind of helps smooth out kind of the emotional highs and lows that surround the departures themselves. So of course, the other thing, the best case scenario is just not to leave the dog home alone. And where it sounds, somewhat flippant for me to say that, it does, by not leaving your dog home alone, we're starting to uncouple those cues of the dog experiencing panic in association with no one being around. So while you're working on the problem, if you're able to actually have, and we're working on the problem and staging short gradual departures, if you can prevent the dog from panicking and being alone, that's the best case option. Right now, if you're starting to go back to work or have friends or family members that you trust, that you could leave your dog with, great. So some of us may be able to have people in our own homes that are still working from home and the dog can be left at home, or friends that are kind of in our friend pod, so to speak. We can leave our dog with them. That might be beneficial as well. There are doggy daycares that are open now. And I think this is also a good resource to have, as long as you know from a health standpoint that the staff at the daycare is taking obviously health and safety precautions as well. So there really is no evidence that dogs can transmit the COVID virus to humans. There have been a few reported cases of dogs getting, or at least testing positive from, for the COVID virus, but we don't know of any cases of dogs transmitting that to people. It's much higher risk that dogs are going, or that people are going to transmit it to other people. So we want to make sure that the daycare staff, if we're going to take our dog to daycare, are keeping themselves and us safe, that they're wearing masks, they're maintaining social distance, and that they have a really good disinfection procedure in their environment. I also want to make sure that they're kind of minimizing their physical contact with the dog. So, back in, before pre-panic days, pre-COVID days, I'm sure all of us would go up to, our friends' dogs or dogs that we knew and hug them and kiss them and let them lick us and things like that. But really, I want to downplay that, especially with people that you don't necessarily know that well. So really looking for staff to minimize their contact with their dogs. So no, not, letting dogs kiss them and things like that. You may also want to be aware of objects that you're leaving with the dog. So things like the dog's leash or collar or harness. You may want to have a separate harness that you take there, but then have the staff members leash up the dog with their leash, and then you take home your dog's leash, harness, anything that might still carry some of the virus on them. So we're maintaining separation of what we call fomites, objects that might actually carry the virus on it. And then when you pick up your dog, it wouldn't hurt, to either bathe the dog or just wipe your dog down with some pet wipes afterwards. Again, the risk of picking up the virus from somebody petting your dog is very, 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 very low, but it wouldn't necessarily hurt to give your dog a bath or wipe them down afterwards. So training that we can do to help increase independence. And this is a great thing for dogs, even if they don't have separation anxiety, to learn, because it can both prevent separation anxiety, but also just teach your dog manners too. A great one that I always advocate is the sit or down stay command. So can you ask your dog to sit or stay while you even leave their eyesight? Because if you can't ask your dog to, be comfortable while you're in another room, that dog is never going to be able to be comfortable while you're gone for 6 hours or 8 hours or 10 hours. So just starting with the dog's ability to be out of your eyesight and not follow you around is a great first step. I also advocate a plan we call Nothing in Life is Free. So it's exactly what we talk about. We're teaching our dog how to be polite. So those dogs that are Velcro dogs that, you're just working on the computer or watching TV or talking to a family member, comes up to you and starts pawing you, or has their nose and starts nudging your hand or barking at you for attention. Those are dogs that are saying, hey, mom, hey, dad, it's time for attention right now. I think I need some attention. And so attention oftentimes is on their demand whenever they want it. And so I really want you to ignore those attention-seeking behaviors. What you're waiting for is the moment the dog's like, oh, fine. because you're ignoring him or her, walks away from you. And then that's the independent behavior that I'd like you to reinforce. So when your dog walks away from you, lies down by themselves, count to 10, and then go give your dog attention. So you're actually using the attention that your dog wanted to reinforce more independent behavior. The other thing that you can do as well is just have your dog say please by asking your dog to sit before you give it attention, or sit before you feed them, or sit before you toss the ball. Anything that you want, your dog likes. Again, attention, food, treats, toys, being let outside to go play in the yard. Ask your dog to sit first. So again, we're rewarding that calm behavior of sitting. So butt on the ground means please with whatever they like. And then for dogs, either with or without separation anxiety, we can start making positive association with departures themselves. Just the extent of how slowly we do this is what is dependent on whether the dog doesn't have separation anxiety, has mild separation anxiety, or has severe separation anxiety. So if your dog doesn't have separation anxiety, and as a preventive measure, we can leave dogs with, a special toy, a long-lasting treat, a puzzle toy. So, hey, when dad's gone, this great greenie or rawhide or something really fun that I only get when they're gone comes out. So I love it. Don't let the door hit you on the way out kind of mentality. If your dog has mild anxiety, we can start with just associating those things when you leave the room for short periods of time, or when you go on your walks for 10 or 15 minutes. That kind of association with just short departures may help. But for dogs with more severe separation anxiety, we do have to break these down into really short periods of time. And so we have to start with very short departures, and this might be seconds. So it's a lot shorter than most people will start with. Just seconds being out of that dog's eyesight, and build up to minutes, and then those minutes build up to hours. So this is a video of a dog where we call it a front door exercise. I'm asking him to stay. I'm leaving a puzzle toy with some treats on the floor, and then telling him to leave it. And then as I walk out the door, that's when he gets the release command to actually go get the treat. So in his mind, he's thinking, please, 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 please leave, because then I get to go get the treat. But when you come back in, the treat goes away, because I'm going to pick up the treat, and he does not get his cake and eat it too. So we can start building up just very short departures with something positive, and building up to longer departures. So obviously, especially with dogs with more severe separation anxiety, thinking about leaving for seconds, then minutes, then hours, that can take a while. And so we can use either over-the-counter anti-anxiety products, or in more severe cases, pharmaceutical anti-anxiety products to help speed up the training process. And so the idea behind this is not that we are trying to drug dogs out just so they're sedate. The goal of medications, whether they're over-the-counter or pharmaceutical medications, is that we're reducing anxiety to help the dog be more open to learning, because it's really, really, really difficult to learn when you're anxious. And so by reducing the dog's anxiety, we can make their minds more open to learning, and we can help reduce the anxiety that's holding them back from experiencing more positive associations with those departures. So again, speeding up the training process. The difference between over-the-counter and pharmaceutical products, for over-the-counter products, I kind of think of as milder, milder forms. So they can be more natural. There's much less risk of adverse effects, and you need less monitoring. I don't really worry about testing a dog's kidney values or liver values to start over-the-counter products. I kind of think of them as the may help, won't hurt category. The cons of them, though, are they do have milder effects. So for a dog that's, ripping the blinds down, these are products that are probably not going to have a huge impact when it's that severe of an anxiety. And they may be a little bit less efficacious because of that. For more severe forms of anxiety, I am an advocate of using anti-anxiety medications, because we do need to stop that kind of perpetual snowballing effect of you're gone, I panic, you have to leave again, I'm going to panic some more. And they're learning, negative associations every single time you leave. So we really need to stop that and clip that in the bud. The pros, again, are they're more likely to be efficacious. We have really good studies showing that these drugs help. The cons are that there can be adverse effects, just like any type of medication. Typically, these are mild, and if we start low and increase the dose, and you're working in conjunction with your veterinarian, those adverse effects are mild and in some cases non-existent. So mild meaning, hey, your dog is a little bit more sedate, but again, I'd rather have your dog sleeping than throwing themselves out of a window when you're gone. Appetite changes may happen, but again, if your dog skips a meal here and they're otherwise eating most of their food, I'm not terribly worried. But it does require monitoring and working in conjunction with your veterinarian to know that these medications are helping and not hurting. So over-the-counter products, again, these are products that may help mild forms of anxiety, or even if you wanted to start dogs on medications where as you're headed into maybe leaving the dog as a proactive preventative measure, that these may help and won't hurt. So one of the big ones are pheromones. So pheromones are natural biologic chemical signals. I kind of typically think of them as almost odors that induce a behavioral change or response. So Adaptol is a product that contains dog appeasing pheromone. It's the pheromone that female dogs release when they're nursing their puppies that kind of kicks that bonding effect and helps calm the litter down. It comes in several different forms, one of which is a plug-in diffuser, kind of looks like a Glade plug-in air freshener type of thing, where you want to plug it into the area where that your dog spends the most time in, because you actually want to maximize the time that your dog is inhaling it and is exposed to it, not necessarily plugging it in where the behavior problem happens. It also comes as a collar, so it's a rubberized collar with that impregnated scent. It also comes as a spray form as well that you can spray, for instance, on their dog bed. But the Adaptol and all of these other products that I'm going to talk about that are over the counter, these are products that we actually have scientific data on. So I'm always an advocate, even with over the counter products, to choose ones that we have knowledge that they actually work. It's not just a company putting out a product where there's no scientific background or backup to know if they help or not. Another product that, again, has some scientific back data on it is a product called Zilkene. It has alpha-casozepine, which is a fun name for a milk protein derivative. So I almost think of this product as that warm glass of milk before bedtime that just helps calm you down and puts you in a very calm state. It's very similar to the next product, Soloquin or Angstane, that contains L-theanine, which is a green tea amino acid. And both L-theanine and alpha-casozepine are proteins that mimic the same, or at least affect the same neurotransmitter that Valium does. So it's that same calming neurotransmitter effect. And then the other product on the screen is called Calming Care. It's a probiotic. And so there's a lot of research now in both the human field as well as the animal field that the little microbes that live in our guts actually have a very pervasive effect both into the rest of our body system as well as behavior. So Calming Care contains a special line of bacteria that helps promote a more calm or decreases anxiety in a number of different animal species. And that's just a little packet that you can add to the dog's food once a day that helps decrease anxiety. So especially in now, even knowing that with that study, going back to the study that we did in Spain, that knowing that animals are experiencing more stress and nervousness, even just with the pandemic, regardless of whether they have separation anxiety or not, any of these products may help and won't hurt. However, for the more serious issues, so again, those dogs that are really having a really impaired quality of life because of the separation anxiety, I do recommend pharmaceutical medications. We're lucky that there's 2 FDA-approved medications for the treatment of separation anxiety in dogs. So there's Clomicalm, which is clomipramine, and Reconcile, which is fluoxetine. Both of them have been studied extensively in dogs and received FDA approval to treat canine separation anxiety in conjunction with behavior modification and training. So this is not a, here's a magic pill and all your dog's worries will be gone. This is a magic pill that helps speed up the training process. So really, training and medication go hand in hand, and you need to do both. The other part is that it's not just those two medications that may be helpful. There might be other medications that your vet might want to recommend that either work on their own or synergistically. For me, I typically like recommending both Reconcile or Clomicalm, as well as another faster acting short duration medication. So thinking of Reconcile and Clomicalm, those FDA approved drugs, as globally reducing a dog's anxiety behavior, but they're still going to experience spikes of anxiety associated with your departure. So I like giving a faster acting medication in addition to those medications, because those faster acting medications can be given just prior to departures and help deal with those little spikes of anxiety. So globally reducing plus reducing the spike of anxiety during the actual departure itself. So just in conclusion, I'd like to kind of show you a couple of videos that kind of puts everything together in perspective. And then of course, I'll be happy to answer some questions at the end too. I wanted to replay that first video of the dog being left home alone. So this is a client's dog that I saw. She was adopted as an adult and had separation anxiety when the owners first adopted her. And so whenever she would leave, this is not her worst video that she would show me, but of course exhibited barking, howling, going from room to look for her owner. And then you might have seen a little bit later on, she goes over to the rugs and was ripping up the mat in front of the door. The windows for the blinds are actually raised on those windows because she did some redecorating of those blinds as well and would rip the blinds down when the owners would leave too. And the reason the door and the windows were left open at this there is that she was actually worse when the owner would try to close the door and she couldn't see out. The owner discovered she was better if she could actually see out through that security door. What we worked on with her was all of the things that we talked about. So she was a dog that I did start on medication, both that long-term medication as well as a medication given prior to departures. And we worked on independence training, so the Nothing in Life is Free plan, a sit-stay exercise, and we started leaving her home alone with an automatic treat dispensing toy. So you'll see that here. So I'll put my little hand on it. So this is automatic treat dispenser. So every time there's a beep, a treat would dispense. You might hear it on the video, but she loved that toy. So as you notice from here, the medication has made her less anxious. So she's actually calmer and calm enough though to be able to enjoy the treats, because this was a dog that in her heightened state of anxiety, she would not be able to eat treats or enjoy anything. So the medication allowed her to be calm enough that we could start making positive associations with the owner being gone. And so she would just sit in front of her little toy that would come out only when the owner was gone. And then she would focus on the treats that were being dispensed. So for her, we're able to work on her separation anxiety and give her something positive to look forward to when her owner was gone. And so with that, as you guys are typing, I'll welcome any questions. And I'll put up some of my contact information as well. So
thank you so much, Dr. Sueda. That's amazing. Were you going to say something about these pictures?
Oh, I was going to say, this is my cat, Tyler, who is watching a presentation on coronavirus with me. And this is my former dog, Luna, who was dealing with the situation much, much differently. So.
But thank you. That was a really great presentation. And as you know, at PetSpace, this is really, really pertinent for us because I don't know that we have data on it, but I'm pretty sure a lot of dogs are turned into the shelter for severe separation anxiety, or their destructive behaviors or barking or things that could all be related to this. And then we pull them from the shelters, and sometimes they have behavior challenges and we don't know what happened with them in the past. But so this is really helpful, and it's the 3 out of the 4 over-the-counter supplements that you recommended, the Zilkine and the Common Care, we use on almost every animal at PetSpace when they come from the shelter, and we saw huge, fantastic results with just helping them de-stress when they've been in a very high stress environment, and then coming to PetSpace, which is a medium stress environment. It's not the same as a home, but it's a little bit better than,
I would not mind living at PetSpace.
So it's really, this is excellent information. So thank you, Dr. Sueda. So let's take some questions. Please put them in the chat. You can send them to myself. You'll see JJ Rollinson as the host on the chat. I see some coming in already, and I'll do my best to get to as many of them as I can. So Dr. Sueda, I'll read them to you if that's okay.
Yeah, absolutely.
How do you feel about CBD oil?
That is a great question, and I'm glad whoever brought it up or asked that question. I think the jury is still out. So the official word is, we just don't know. There's been no real studies looking at CBD and its effects on animal behavior yet. I'm looking forward to the day when I'm sure it'll come when we do have those studies. I always have some concerns about using CBD in animals, only in that, again, we don't know what the benefits or the harm is. And in humans, I do know that CBD can have changes to the liver system, which can interfere with the way other drugs and supplements are metabolized. So there can be some drug interactions with CBD that they know from people. So typically when clients come to me, I say, I'd rather you not use CBD if we're going to use other medications in a pet.
Great. Okay. Does leaving the TV on when you leave help?
I think for some pets, yes. So again, those milder forms of separation anxiety, I think hearing some background noise, but we have to choose wisely what to leave on. Obviously we don't want to leave on, maybe a pet channel where they're going to hear a lot of other barking dogs, if that's going to, stimulate your dog. I have one client who had a great suggestion. She left on the golf channel because it's just commentary in a very quiet voice. So they hear your voice in the background, but it's very quiet. They do make dog TV. So there's actually a channel called Dog TV that has periods of time during the day where it is kind of a calming, soothing music. And apparently the screen and the colors on the screen are maximized for dogs' sight, so to speak.
Fantastic. Is separation anxiety hereditary in any way? Do you know?
Yeah, then that's a great question. So in a way, probably it can be, because there are genetic factors that play into anxiety. What we do know too is that because there's some what we call comorbidities with other anxiety disorders, there probably is some genetic basis to it. But breed-wise, different pedigree lines, we see it all over the place. So I've seen every single breed has a potential for showing separation anxiety. And I've seen it in puppies as young as 8 weeks as well. So, I think there probably is a genetic component to it.
Sure. I imagine. Yeah. So got some great questions coming in. For those automatic treat dispensers that you highlighted, does the remote have a maximum distance where it stops working after you reach a certain distance, or are they Bluetooth, or are they Wi-Fi, or how do they work?
All of the above. So it depends how much you want to spend on them.
Got it.
So yeah, there's several different ones out there. There are ones that are, a little bit on the more pricey end that are Bluetooth capable. So you can use those to dispense treats. There's ones that are handheld remotes that have a pretty good range to my knowledge, definitely in other rooms or other floors of the house, even through cars, we've used it there. And then there's also ones that you don't have to use a remote. You can actually set it and it will automatically dispense treats on a timed basis as well. So just look up, there's a bunch of different products.
Great. So this family just adopted a pet and she's displaying some signs of separation anxiety. Do you know of any evidence that rescue dogs suffer from this? I think we all have anecdotal evidence. Is there any evidence that rescue dogs have it potentially more than dogs that maybe came from a breeder or were well socialized? Or
Yeah, so both. Yeah, so yeah, you can see. I think the studies have shown that there is a little bit more higher likelihood of separation anxiety in dogs, whether they came from a shelter or a rescue group or they're rehomed. I think the question though is, it's a chicken or the egg phenomenon, which came first. So what we don't know are, were those dogs relinquished from a past household because of separation anxiety? So like you're mentioning before, Dr. Rawlinson, some of these pets might have been relinquished because of the issues that they previously had. Or is the separation from their previous household a stressor in their lives that have predisposed them for separation anxiety? That, I'm sure both things play a role.
that makes sense. I wish we could have a little glimpse into their past lives. It sure would help us a lot. Okay, is a dog humping their bed when left alone a sign of separation anxiety or just frustration? And can using Adaptil spray on the bed help minimize that particular behavior?
Yeah. So I think it's definitely worth trying Adaptil to see, because again, if Adaptil is helping the dog calm itself, then that may help. I think it's hard to say whether or not that humping behavior of the bed is what we call a displacement behavior. I'm frustrated, I'm stressed, and this is another behavior I'm going to do as a sign of that stress. Or it's just, hey, this is fun. Maybe I'm not supposed to do this when my mom or dad are home. And so when they're away, I'm going to hump the bed and then I'm going to drag it around the room and like toss it around and have fun. So anytime you think that a behavior might be anxiety related, think of it as one little flag, but look at all of the other behaviors that are going and body language that's going on as well too. And the more of the different signs, so for instance, if that dog was humping the bed and he was whining and his ears are back and his tail's down, and then he drops the bed and then goes to the window and looks out and he's nervous, then yes, that might be a sign of anxiety. But if he's humping the bed and then tossing it up in the air and then prancing around, it's probably just a fun behavior that he's doing.
Sounds like a lot of dogs I know. So somebody said, to confirm what I heard, if my dog calms down and is fine while I'm away, after about 5 minutes of severe howling and crying, is there really a need for real correction?
So probably what I would say is, if your dog is howling and then able to calm down, what is the quality of that calm behavior? Because what I would want to differentiate as a behaviorist is your dog truly calm, like able to fall asleep, able to grab a toy, go about their normal life when you're gone? Or is that calm behavior actually shutting down? So there are dogs that experience stress by what we call learned helplessness. Like, the world is out to get me. I can't do anything about it. So I'm just going to shut down. And so is that calm behavior, I'm going to lie here and just internalize everything? Or is that calm behavior, oh, I'm completely relaxed and I don't have a care in the world? If it's the latter, then, maybe leaving the dog with some toys to take care of those, to do something else during those first 5 minutes may help. But if you feel like that calm behavior is more a reflection of the dog shutting down and not enjoying, then I would consider that to also be a sign of anxiety.
Got it. Excellent, thank you. We have a few people who've asked if we could have the recording of this presentation afterwards, and yes, it will most likely live on our PetSpace YouTube channel sometime in the next week or two. So got a few pre-vet students that want to go into behavior that want to make sure they have this in their back pocket. So a few more questions. Do you approach anything differently with a young puppy showing signs of separation anxiety? And I suppose it depends how young, but.
Mm-hmm. Exactly. And that's a great question, because I think it's any type of behavior issue that if they're starting to show it as a young puppy, we really want to work on that now, because it's likely that if we don't address it, it's just going to get worse in the future. Those are dogs where I think working with a trainer, so I think you were mentioning, Dr. Rawlinson, that you have some training classes. and starting to work on some basic skills will help those young puppies. And then if those young puppies are showing relatively severe signs of separation anxiety already, those are things you really want to talk to your vet about, because we want to address that before it gets worse.
Yeah, that makes sense. You're talking about our mutt manners class. It's really great. I think that the training is as much for the people as it is for the animal, and also having, I think, just developing your ability to read your dog's body language and what they're trying to tell you. I mean, once you have that skill, you just will better understand your animal. Okay, a few more. I know we're running over a little bit, but there's some really good questions here. I hope that's okay. So what about the cameras where the owners can communicate with the dogs? Does that make it worse? Does that make it better?
Again, I've seen it both ways. So I've had clients where they do feel the dog actually will calm down, because it's kind of like, oh, well, I guess dad's still around if I can hear him. So I've had owners where it does calm them down. I've had other dogs where it just makes the dog worse. So if they hear the person but can't figure out where the person is, it contributes to that frustration and anxiety. So just like with anything, there's no hard, especially when behavior is concerned, there's no hard and fast rules. I think it's worthwhile trying to see if just speaking to the dog helps. But if it doesn't help within the first 1 or 2 tries, it's unlikely to help. So it's not worth keep trying.
Got it. Okay. Among the over-the-counter calming aids that you recommend, is evidence for one stronger than the others? Meaning, which one should somebody start with and try if they want to use one?
Yeah, I think it depends. So the evidence is really across the board for all of them. The one I would probably start with is Adaptol, the pheromone, mainly because I think it's easy. It's a plug and play a lot of the time. It's something that you can set it and forget it for the next 3 to 4 weeks. And so that's the one that's a little pheromone plug-in diffuser that you can plug in. Or like I think Dr. Rawlinson uses at PetSpace too a lot, is the spray form on the dog's bed, and that I would spray once a day or so. I would start with that, because at least it's not something that you have to pill the dog or add to the food on a daily basis.
What about, have you used Rescue Remedy? Have you had any luck with that?
I have not. I will caveat by saying that I don't tend to have a lot of luck with it, but the cases that I see are usually the worst of the worst, and clients have already tried it before. So Rescue Remedy is, a kind of a Bach flower essence type of a medication. It's drops that you can add in the dog's water or in their mouth. Again, may help, won't hurt. And if that's something, it's something to try. But again, most of the clients that have used it have tried it, and it hasn't been that successful for them.
Got it. Okay, I think the last questions that we have are very specific questions to a particular dog's situation. So what I think that would make sense, since we've run over time here, is if everyone who still has a question that didn't get answered, if you want to email that question to communications@annenbergpetspace.org, we'll try to get those questions answered for you. Some of the questions were specific situations where there was animals that were having some behavior challenges, and so I think Dr. Sueda, you would probably recommend talking to your vet about that. And if your vet needs some support, the vet can reach out to Dr. Sueda, and they can develop a relationship and potentially get a consult with Dr. Sueda if you're in Los Angeles. So I don't want to go into those situations too much, because I think they're very complicated. But otherwise, I think we have wrapped up all the questions. This is really great. Again, additional questions, communications@annenbergpetspace.org. Dr. Sueda, this has been amazing. Thank you all for your questions. Excellent information. I'd love to extend an invitation to some of our additional online events while we practice social distancing. In particular, this month, if you haven't seen it already, we're celebrating Dogist, the universal birthday for shelter dogs. So tune into our Instagram live account each Sunday in August at 3 p.m. to be a part of this special ongoing event. It's really fun. Thank you again to Dr. Sueda for taking the time to share all of this great information with us. And thank you all of our viewers for joining us this afternoon and continuing to support Wallace Annenberg Pet Space. Be safe, be well, everyone. Thanks, and we hope to see you again soon. Thanks again, Dr. Sueda.
Thank you.
Really appreciate it. Have a lovely day, guys.